Welcome to Dental Office Emergencies, Model 8. This week, we will review the following videos: acute asthmatic attack, obstructed airways, and allergic reactions. The readings of chapters 13, 14, and 15 are required prior to completing the quiz bank questions and taking the quiz. Your topic for the 7th discussion posting will be presented at the end of this lecture.
Bronchospasm, or the acute asthmatic attack, is a common condition found in many dental patients. The acute episodes occur when smooth muscle surrounding the larger bronchi and bronchioles go into spasm. During this episode, the lumen of the airway is considerably narrowed, causing the victim to experience extreme difficulty breathing. This results in the victim not moving enough oxygen into their lungs or carbon dioxide out of their lungs. Therefore, asthma has to be treated promptly or it can be fatal. When a new patient in the office describes themselves as asthmatic on their medical history, the subsequent dialogue history should include the following questions. What type of asthma do you have? Asthmatics have either allergic asthma or non-allergic asthma. Non-allergic asthma is frequently induced by fear and anxiety or the absence of adequate pain control. Find out if the asthmatic patient is frightened of any aspect of dental treatment, because this fear alone could trigger the acute asthmatic attack. If they have allergic asthma, you should ask, what are you allergic to? Aspirin is a very common cause of allergic asthma. What drugs do you take to control your asthma? Asthmatics usually take 2 drugs. One is their rescue drug, commonly a bronchodilator such as albuterol, for the management of the acute episode. More and more commonly today, the asthmatic may also be taking a preventative medication such as an inhaled corticosteroid on a daily basis to minimize the occurrence of acute episodes. How often do you have asthmatic attacks? And what triggers your asthmatic attacks? If the patient says, whenever I get scared, I have an asthmatic attack, and doctor, don't take this personally, but I hate going to the dentist, this patient is more likely to have an asthmatic attack in the dental chair. Sedation is indicated in this situation as a means of preventing the acute episode from developing. Have you ever had an attack that did not stop? And have you ever been hospitalized for your asthma? These questions help determine whether or not emergency medical services should be immediately activated in the event the patient has an episode of bronchospasm in your office. I strongly recommend that when your office calls to confirm the patient's dental appointment, you remind them to bring their inhaler, their rescue drug, with them to the dental office. So what do you do if the patient has an asthmatic attack during their dental procedure?
All right, I'm gonna have the mirror next floor. We'll take a look what we're gonna do today, and we will get started. Thank you so much. All right, Don, would you please open for me? Thanks. Let's see. What's wrong, Don? Okay. The very first thing I did was put Don in a very comfortable position. People that are having problems in breathing prefer to be in an upright position. In addition, we had put Don's inhaler on our bracket behind him. We got his inhaler so he could start with the bronchodilation treatment. If his dilator was not successful, we had our own bronchodilator, which we would have let him use, but we were successful in treating this with his own.
So, definitive care for an acute asthmatic attack is to allow the patient to self-medicate using their rescue drug. The bronchodilator acts directly on the constricted bronchial smooth muscle, producing bronchodilation in about 20 to 30 seconds. A usual dose is 2 puffs. A second dose may be given if the patient continues to experience difficulty breathing after 5 minutes. In this scenario, once the patient recovered, he wasn't comfortable with continuing with the dental treatment.
Maybe we can reschedule. Would that be okay, doctor?
Absolutely, Don.
Okay.
You know, in fact, I think maybe I'll give you a prescription for something to sort of calm you next time, because that's probably what precipitated it, because you said you were a little stressed.
Had he wanted to continue, it would be okay, provided that you, the doctor, and the patient are both comfortable doing so. But before returning to the treatment, find out why the episode happened. Most often we find out that the patient was scared. Treat the fear before you continue the treatment of the patient. The most common cause of airway obstruction is choking on food. Initially, this victim is conscious but is unable to speak. If the airway is not reopened in 15 or 20 seconds, the person will lose consciousness. Let's hear how Dr. Barbara Steinberg handled this.
I have you rescheduled for Thursday at 9:20 in the morning. Is that going to work for you?
How about, can we do it in the afternoon? That's better
Thursday?
for me. Yeah, that's fine.
I don't have an opening Thursday, but I have...
Afternoons are better, so whatever day you got in an afternoon.
Looks like I have one Friday at 3:30.
Okay.
3:30, Friday. Are you... Clint? Are you okay? What's wrong? Are you choking? I think he's choking.
The macho man, again, had another emergency on the day. He wasn't having a good day. This was, keep in mind, the same patient that fainted. My assistant, Amelia, noticed that this patient was choking, and she went up to him and proceeded to do the Heimlich maneuver, or the abdominal thrust, as some people call it.
Okay, breathe, just breathe.
At that point, I entered the room and I saw that everything was quite under control, was handled appropriately.
What's happening?
Clint is choking on a piece of candy. Candy is
I'm
better
good.
now.
I'm good.
And you're all right? You didn't have such a great day today.
No.
It's not been a good day. No, it hasn't.
You're all right now?
I'm good.
Even though he said he was doing fine, I informed him that we needed to have him checked out medically to make sure there was no damage done when the Heimlich maneuver was performed.
Clint, we really need to get you checked out medically. Make sure everything is okay. I can't let you go home.
Okay.
All right.
All right.
I'll take care of that.
Obviously, this situation could happen anywhere, in an office, a restaurant, and everybody should just be really attuned to the patient that does demonstrate this universal choking sign and to offer assistance. So I don't think we could do anything differently.
There have been deaths related to small dental items getting lodged into the patient's trachea. Therefore, it is recommended that all small objects placed into the oral cavity of a patient during dental treatment have a length of dental floss tied around them to permit easy retrieval from the mouth in the event that they are aspirated. Sometimes it's the little things we do that save lives. Allergy is an overreaction by the body's immune system to a foreign substance called an allergen. Common allergens include penicillin, aspirin, latex, strawberries, shellfish, and peanuts. Mast cells are a component of the body's immune system and are found in great numbers in the skin, lungs, and blood vessels. When one of these allergens attaches to a drug receptor site on a previously sensitized mast cell, chemicals stored within the cell are released into the tissues in that area. These chemical mediators of allergy are responsible for producing the clinical signs and symptoms associated with allergy. The primary chemical mediator of allergy is histamine, which produces itching, hives, rash, bronchospasm, and vasodilation. Histamine produces virtually all of the clinical signs and symptoms of the allergic reaction, and the severity of which depends upon how rapidly these chemicals are released and where they are released. If the chemicals are released into the skin, which is the most common site, allergy is confined to the skin, nothing more than itching, hives, and a rash. This does not represent an acute life-threatening situation, but it does require immediate treatment. If histamine is released within the lungs, it produces bronchospasm. If released within the cardiovascular system, it produces vasodilation with a subsequent drop in blood pressure and possible edema. These are the life-threatening allergy called anaphylaxis, which requires immediate and aggressive management if the victim is expected to survive. In discussing allergies as a medical emergency, I describe two categories based upon the speed at which the signs and symptoms occur: delayed onset allergy and immediate onset allergy. Delayed onset allergy is one in which the clinical signs and symptoms occur an hour or more after exposure to the allergen. Most allergic reactions are delayed onset, involving the skin, and therefore they are non-life-threatening. Consider a situation where a patient comes into the office an hour after having taken prophylactic antibiotics.
Yeah, I'm just feeling a little itchy.
Yeah, it looks like you've got a little bit of a rash there. Did you take your penicillin this morning?
Yeah.
Did you notice the rash before that, or did it start afterwards?
The patient who presented with the mild allergic reaction did not require as aggressive a treatment as a patient who is having an immediate onset or anaphylactoid type reaction.
So I suspect what we've got is just a reaction to the penicillin. So what we're going to do is just give you an antihistamine to calm the reaction down and see if we can't get things under control a little bit, okay? Brian, you want to draw me up some diphenhydramine? How's the family doing?
Good, good, good.
Good. Kids in college yet, or?
I wish.
And what we're going to do, he's going to give me the medicine. I'm just going to give it to you right in the muscle of the arm here.
With a mild allergic reaction, there is really virtually no definitive thing that could be done differently to avoid such a response. The main thing to be done is awareness, both on the part of the patient, part of the dentist, and the part of the staff, as well as the pharmacy and any other professionals involved, that there's always a potential for an allergic reaction to any medication at any time, and it should be reported immediately if it occurs.
Immediate onset allergy is when the clinical signs and symptoms develop rapidly, in seconds or minutes following exposure to the allergen. This allergy involves not just the skin, but also the respiratory and/or cardiovascular systems, and requires immediate and aggressive management with drug therapy if the victim is to survive.
Hi, Stacy.
Hi.
How are you?
Not so good.
Did you take your penicillin?
Yes, but my throat is feeling really tight, itchy, and my lips are feeling really weird.
Okay. Let me call, see if the doctor will see you right away. Hi, Kristen. Stacy Cannon is out here. I think she's having problems breathing. Can you see if the doctor will see her right away? Great, thank you. Stacy, the doctor will see you soon. Could you go ahead and take a seat?
Treatment of the anaphylactic reaction follows the PABCD sequence.
I have Stacy.
Position the victim appropriately. If unconscious, place in a supine position. If conscious, whatever is most comfortable for that patient. With the unconscious patient, airway, breathing, and circulation are assessed and done if needed. Have one of your staff activate 911.
Just stay calm. You're fine. Give me the green twin jet and go ahead and start some oxygen for him. You okay? That's right.
Immediately get the epinephrine syringe and give an injection into the patient's thigh.
Got a little bit of a stick coming in your leg here, okay? Okay, great. Thank you. Okay, great.
I'm gonna go wait with her.
That's wonderful. Okay. You're doing fine. You really are.
Epinephrine is administered as soon as possible at the onset of apparent anaphylaxis. If there is any doubt as to whether or not anaphylaxis is occurring, it is generally better to administer epinephrine than not. Epinephrine is the drug of choice in anaphylaxis because it does two things that are of critical importance. Number one, it is an excellent bronchodilator. If bronchospasm was a component of the reaction, the airway should now be dilated, permitting more normal breathing. Number two, epinephrine also elevates the blood pressure. In many anaphylactic reactions, the blood pressure drops. And most importantly, epinephrine given IM works fast. Remember, while the victim's life is still in danger, continue PABC as needed and administer epinephrine every 5 minutes until the victim either recovers or until help arrives on the scene.
It's been a few minutes now, so I'm just going to get ready to give you a second injection of the medicine, okay? Okay, just try to relax. sweetheart. Just relax for me, okay? You're doing great. Okay. You're doing great. Okay. It's all done. Just relax. It'll be great. It'll be fine.
Once your life is out of danger, then the histamine blocker diphenhydramine is administered IM.
Great. Come on in, guys. Everything's good, Kara. Just relax, baby. Hey, how are you? Looks like Stacy here is having a little bit of an allergic reaction to the antibiotic.
Okay. How long has that been going on?
She arrived at the office about 20 minutes ago,
Okay.
and she was in slight distress when she got here.
Okay, have we done anything for her?
Yes, she's had 2 doses from the Twinject.
Okay, let's go ahead and we'll transfer their oxygen.
Epinephrine does not reverse any soft tissue edema that may have occurred. However, it will stop any further increase in swelling from developing. The importance of epinephrine administration is emphasized by the fact that in the anaphylactic reaction, there is no absolute contraindication to the administration of this drug.
Please address the following questions for the discussion posting this week. What object or equipment will need special care in handling to avoid a possible airways obstruction during a dental hygiene appointment? What precautions will you take to avoid an emergency situation when using this object or equipment? Please post your initial posting by Wednesday midnight and complete a response to one of your peers by Sunday midnight. This concludes the audio lecture for the week.